and easy. Take the device out, remove some of the fibrous tissue that builds up as you coagulate the fibrous septi. Again, reinsert, take your foot off the pedal, find your plane, and begin again. Nice and easy, nice easy contouring. We're already at 31 degrees. We've taken it from 23 to 31 in just under a minute. We're about 32. As you can see, a beautiful epidermal surface, no arcing, no erythema. Always watch for those. If you see an arc or a little, you hear a popping sound, or if you see an erythematous patch, stop. Stop. Again, making sure you're not dimpling the dermis. Use counter traction. Nice even strokes. We're already up to 34 degrees. Now our target is 40 degrees, and then we'll hold it. We'll hold it for about a minute to maintain that critical temperature, which will mean we'll be about 50 degrees subdermal. We're now at 36 degrees. Very soon you'll be hearing a warning. We're within 2 degrees of our target temperature. There we go. Listen. That tells me I'm at 38 degrees. And very soon we'll be at 40. Now we're at 40 degrees, and I go to where I'm not at 40 degrees. I'm going to get that temperature up to 40 degrees. And once I have a homogeneous profile of 40 degrees, I just keep moving in the zone now for about 1 minute. Back and do lipo-contouring refinement, but we've got enough thermal deposition. Now I'm going to do the submental zone. Make sure we have some gel. And we're going to go into the submental zone. Now same thing. Introduce first. I'm on level 1, about 15 millimeters between the electrodes. Introduce first. And make sure the head is an extension. And hold this please. Thank you. And I'm going to go back and forth and just make sure I like my plane. Make sure there's no dermal dimpling. Make sure you have a nice even plane in the adipose tissue. And we're going to do all now of zone number 1. Same thing, nice and even, back and forth. 15 watts, nothing aggressive. Sneak up on your temperature and your endpoint. Don't be too aggressive. Use counter traction. The head is an extension. If you start to get dermal retraction, stop and get a nice smooth plane like that, and then put your foot pedal depressed again. And we're starting at about 24, 25 degrees. I'll do half of zone 1 first. We're sucking as we go, aspirating as we go. We're up to 32 degrees now with just a couple of passes. Come right up to the margin with the level of zone 2. And we're at about 34, 35. And we'll soon hear a double beep as we get to 38. In just a moment. There we go, we're at 38. We're going to go back and forth now until we get to 40. Nice even strokes. And now we're at 40. We're not getting any RF. I'm just going contouring. Now we're getting some heat. And now we're not. We're just getting contouring once you hit 40. And I'll cycle like this for, again, another minute in this part of the zone. Then we'll move the endotracheal tube and go to the contralateral side of zone 1. Okay, let's stop now for a moment. We're going to go to the other side, but even without my SAL cannula, look at the nice contraction we've got, the nice removal of tissue, the improvement of the cervical mental contour. You'll get about 15% contraction on the table and another 25 to 35% contraction over 3 months. So we're going to go to the contralateral side, we'll come back, and I'll do some SAL lipo refinement. Our RFAL, we've got a nice contour without even doing the lipo aspiration refinement yet. One important point, if you want to get tightening right down to the base of the neck, you need to put the neck in some extension. If the patient's awake, they can simply tilt their head back, or you can put a roll under the neck, or if you have an OR bed, you can release the OR bed and put the neck in some extension. That will allow you to get your device, once inserted, you get your neck tight, right down to the base, as you can see, right down to the base of the neck. You need the neck in some extension to get down to those areas if you want to do lipo contouring and tightening RFAL down to the clavicle. So neck extension. Okay? Let's finish now with some lipo refinement. There are many different cannulas that doctors may enjoy in the neck. There are some simple syringe cannulas, blunt nose, small, 2.4, 1.8 millimeter cannulas. A very popular cannula is a spatulated cannula in the neck, where there is no hole on the back of the cannula, but on the undersurface, so that you don't thin the dermis too much. And this is a very popular cannula for lipo contouring following neck tight. Again, we've been able to do this entire case through the submental incision. We run our cannula in the same plane we've done RFAL. It is vented, so we're doing some aspiration as we go. We're doing some final contouring here. I'll start out laterally and then we'll move centrally. Very easy to move through the tissue when you've done RFAL. No need to be very aggressive. We've already got some coagulation of vessels, coagulation of fat. There's a very, very gentle aspiration. And if you look at the aspirate, you can see that the aspirate itself, if you can hold that up and you can watch while we're doing this, it's just not very bloody. Now, some necks are more fibrous than others if they've had previous surgery, male necks, and there may be some blood. But you can certainly assure the patient that using a radiofrequency assisted lipoplasty and lipocontouring in the neck, you'll get less bleeding than if you did it with SAL, because we pre-coagulated the vessels, we pre-coagulated the adipose tissue, and it's much easier extraction. So nice, easy lipo-aspirating. Now, if you want to round the corner and get at a little bit of that jowl, you can from the submental space. So we'll do a little bit of lipo-contouring of the jowl with this flat spatulated cannula. I don't do a lot of removal of fat in a patient's face. I rather reposition it. But we're just lifting up the skin off the underlying jowl, and she's going to have a lift in a few minutes. So this is closed management of the neck and jowl using neck tight. And then we'll go into the submental space. I want to feel that. Remember how much we had before? And now you can see we have very little fat. I'm basically rolling the skin between my fingers. Very little fat left. So let's make sure we have a nice smooth contour. We'll do a little bit of lipo refinement here using our flat spatulated cannula. We did the entire case at 15 watts. Nice, safe, slow profile. When you're first starting, try 12 watts, try 10 watts. So it takes 3 or 4 minutes rather than 2 minutes to get up to 40 degrees. Always be safe. Look for areas of erythema, any areas where there might be a small little degree of epidermal arcing, and if that's the case, usually I'll put a little 6-O-proline in that to close that area. But with the new configuration of the electrodes, with the new configuration of the power density, that is very, very, very uncommon. And again, a little lipo refinement. Now look at that nice contour on what she started with. Very little fat now. The skin's going to contract nicely and give her a nice neck result. So I'll do the contouring on the contralateral side. We'll come back for a few final comments. Completed neck tight of the cervical mental area. You can see a beautiful contour we've achieved. This individual is going to go on and get an upper face and mid-face lift. Simple closure. I generally use a monofilament like a polypropylene or proline or a polyethylene, 6-O or 5-O in size, and I will take this suture out at about 6 days. There's some post-operative instructions if you're just doing plain neck tight. We use a compression dressing, usually with a little bit of foam, so a little bit of epifoam, topifoam, or foam, followed by a wrap. And the wrap should be worn around the head and the neck for pretty continuously, 22 out of 24 hours for 3 or 4 days. If they do it on a Thursday or Friday, they have to go back to work the next week, and they're fortunate enough with the RFL not to have much bruising, then they can do that. But when they come home in the afternoon, the evening, they must wear the wrap through the night. And they should do a 12-hour wrapping then for a subsequent 2 weeks.